The American Health Journal.
Next, we take a look inside the emergency department at Mission Hospital in Mission Viejo. Dr. Jim Keeney tells us what it's like to be an emergency physician and what you can expect if you visit the ER.
When do people need to look into seeing a doctor immediately in an emergency room? And it's a hard question to answer because there's so many unique episodes that come up. I would say that if you're concerned enough that you think you need to go to an emergency room, that's good enough for me. The truth is, we are there to take care of anyone who feels like they need emergency care. So no matter how minor it seems, if it's something that a person feels is potentially life-threatening or very painful or can't wait, or they just have a very high level of concern, I think they need to come in and let us take a look. It's not first come, first serve in the emergency department. It is the sickest come first. We use a system we call triage, which means classifying the sickest to come back first and the less sick wait longer. We do that naturally because we want to make sure that we get to the people that are going to have bad outcomes as quick as possible. When I was a medical student, most of the diagnosis was made by taking a history and doing a physical exam, and there was limited tests available. I mean, ultrasound was just being developed. CAT scans were really just being developed. So we really didn't apply that to so many patients. Now, between the fact that the population is getting older and this increase in technology, we end up applying so much of this to so many of the people that come to the emergency department. That's part of the problem. That's part of what backs us up. We can't get people moved through the department quite as fast because of all the new life-saving procedures that we can do. The high moments are always when someone, they talk about in first aid, airway, breathing, circulation are the ABCs of medical care. And really emergency medicine is that simple. We just keep the air going in and out and the blood going around and around. And that's our job. So when someone comes in, for example, with an asthma attack or an emphysema attack, and they are on literally their last breath, and somehow it always happens that way. The drama plays out that they keep it going as they're getting to the hospital. But as soon as they get there, some kind of letdown happens, and they will often just stop breathing right there. And I took care of a 70-year-old woman recently who had emphysema. And she had this exact scenario. She got to the hospital, suddenly stops breathing, and the whole team pulls together, grabs all the equipment that we need. I don't have to individually do all this myself. I couldn't in that much time. I need a team to support this. The nurses know exactly what drugs to give. Someone's starting an IV. A respiratory therapist is setting up my equipment to put in a tube. And within less than a minute, we have a tube in this woman's lungs, and she's hooked to a breathing machine where we can breathe for her. And that's something where you got to watch someone staring over the precipice of death, and you got to pull them back from that edge, at least this time. So that's exciting. Another reason I like working here specifically at Mission Hospital is because of the breadth of medical capability we have here. We have the children's hospital, we have a stroke center, a cardiac center, we have a trauma center. We have all the things that I need to be able to really feel like I provide very good care for the patients. And it's not me providing that very good care necessarily, it's a team of people at Mission Hospital that are very highly trained and very dedicated to what they do. So I know that when I pass that person along from my care to the next doctor that they're going to get very good care, and that leaves me with a good feeling.